As Rhode Island continues its road to reopening, there was some mixed news today. The number of Rhode Islanders hospitalized with COVID-19 hit the lowest level since March. But for the first time, the state now has seen a child diagnosed with a rare syndrome linked to coronavirus. Here's where things stand right now. The Department of Health says 7 more people have now died of the virus, bringing the death toll to 927. Meanwhile, hospitalizations fell below 100 to 93. 16 people are in intensive care and 15 are on ventilators. In addition to declining hospitalizations, the state continues to report a low rate of positive tests. The daily positivity rate is 1.1%, the lowest since testing ramped up. Eyewitness News Politics editor Ted Nesi is at the State House with the governor's latest thinking about when Phase 3 of reopening will start and how your travel plans could be impacted. Ted?
Shannon, good evening. Well, the governor is keeping a nervous eye on the other states that are seeing spikes in coronavirus, and she acknowledges that is playing into her thinking about Phase 3.
What's happening in Rhode Island is very different from many other states.
With coronavirus cases and hospitalizations around a 3-month low in Rhode Island, Governor Gina Raimondo urging residents not to be complacent.
If we stop following the rules, stop wearing our masks, stop washing our hands, staying home when we're sick, we're going to be in trouble, just like that. And if you don't believe me, look at what's happening in Texas and Arizona.
Raimondo confirming she expects to announce new travel restrictions on Monday for travelers coming from hotspot states like Florida.
It's easier said than done to figure out all the what-ifs and how you execute it on the ground.
You mentioned on CNBC the other night potentially to have mandatory testing. Is that still something you're considering?
Yes. Yeah, that's exactly what we're considering.
Also on tap for Monday, a decision about whether Rhode Island will move to Phase 3 of reopening on Tuesday. The governor's still not ready to make that call yet.
You know, we'd like to see today, tomorrow, Sunday, what does our rate of spread look like? Make sure there's nothing. A few more days matters.
Meanwhile, the health department has confirmed Rhode Island's first case of a rare condition linked to coronavirus called MIS-C, short for multi-system inflammatory syndrome in children. The patient, described as a school-aged girl, remains hospitalized but is not in the ICU.
Although multi-system inflammatory syndrome in children can be serious, most children who have been diagnosed with this condition have gotten better with medical care.
And I did ask Dr. Alexander Scott if she knew of any other children in Rhode Island who are suspected of having MIS-C. She said she is not aware of any other potential cases right now.
Well, Rhode Island continues to see relatively low numbers of coronavirus cases, but other states that have reopened are grappling with new outbreaks. Tonight, Governor Gina Raimondo has a strong warning for parents. Eyewitness News Politics editor Ted Nesi is at the State House with what the governor is asking parents to do. Hi, Ted.
Hi, Shannon. Well, the governor is arguing that right now the biggest threat to the health of children in Rhode Island isn't coronavirus. It's the 52% drop in immunizations that's been experienced in the state since the last 2 months.
We're behind. It's a problem. It's going to manifest itself in big problems in the winter if we don't get these kids checked and immunized. Parents, if you have a child who is under 2, a baby, or you have a child who is age 4, age 11, or age 16 and needs a vaccine, or you're behind on the vaccine, or you missed a well visit, or you missed a screening in the past few months because of coronavirus, I need you to call your doctor today or next week and get an appointment with your pediatrician or your primary care provider. We intend to open school August 31st. We want these kids back in school in September. That means we need them all immunized and checked. Babies under 2 have to have a certain set of shots. 4-year-olds, it's key, 11 and 16. The pediatricians on our advisory group are cautioning, warning, especially for our 4-year-olds who are going to start pre-K in the fall for the first time. We absolutely must make sure every single one of them has their measles, mumps, rubella vaccine shot. The MMR must get that shot.
And the governor says she does understand that some people remain nervous about going places where they could contract the virus, but she's confident the doctor's offices have taken the precautions necessary to keep people safe. She also says some of them plan to add nighttime appointments to make it easier for parents to schedule these appointments. Live at the State House, Ted Nesi, Eyewitness News.